This presentation will focus on the role of exposure assessment, begin to review the components of exposure assessment, and think about the role that they play in various environmental and occupational exposure scenarios. The main objectives will be to describe common exposure scenarios in the field, review various types of exposure assessment, contrast and compare approaches in terms of how they contribute to occupational and environmental studies, and identify issues that can help us learn about novel approaches to understanding what we should be doing in the modern era of exposure assessment. When we think about environmental or occupational exposure scenarios, we can think about 4 good examples of common categories. One would be unintentional release from a fixed site. This could include something like a train derailment and release of chemicals, or something as large as what happened in Japan with the Fukushima disaster, where a nuclear reactor melted down and radiation was released into the environment. Think about routine releases from fixed sites, such as coal-fired power plants, or even dry cleaning factories where they may release volatile organic compounds into the air. We can think about ubiquitous exposures, which are exposures that are constantly in the environment, not as a result of a intentional or unintentional release. For example, the presence of disinfection byproducts in drinking water. They're there, they're not being released over periodic amounts of time, they're constantly present. And we can also think about recurrent exposures and recurrent responses, whereas recurrent exposure to air pollution may cause asthma to worsen. And each of these has a different environmental and occupational risk, and also a different exposure scenario for which we have to think about what data we can collect to better understand the exposures that were happening at or during the time of exposure. During acute chemical incidents like the Fukushima disaster, we often think about 3 main activities why we would collect data on environmental exposures. The first would be to inform a risk assessment. The second would be to help us define the group at risk. And then the third would be to generate exposure estimates for epidemiologic studies. Authors reviewed the type of common exposure assessment that occurs during these acute disasters, and they found that there are 4 categories where exposure data were being collected and used. These 4 scenarios include both early phase collection, of course, right after the disaster, and then late phase collection. And they consist of where no exposure data was ever collected for risk assessment or other purposes, ranging to there was a lot of exposure data collected early on and can be used in health studies. And it's a broad range of types. And so when we think about these kind of unintentional releases, these are much more difficult to assess and capture, often because it might rely on people remembering what they were doing, where they were, and historical estimates of exposure. If we think about particularly the most recent unintentional release of chemicals into the environment, the Fukushima disaster, in this analysis provided by the WHO, they were attempting to understand the relative contribution of different sources of exposure for an individual or a child under 10 living in the areas most affected. And they looked at, in this graph, effective dose. They looked at dose over time, so the months following the disaster, and you can see that on their estimates of dose, the majority of the exposure is happening from ground shine or radiation that has been distributed into the ground or the soil. And very little happens in the very first month, but happens because of inhalation, ingestion, and then cloud shine, which is really the initial first release. So you can see these incidents are very complex, and many times the ability to estimate exposures can be impacted because of the nature of that type of release. When we think about the role that exposure assessment plays in epidemiology, it is a crucial component of environmental occupational epidemiology research. And one of the key things that we hope that exposure assessment does is the better we are at it, we hope it can reduce bias and improve power to detect associations. So it's very important to review and understand the choice of exposure measures that are needed depending on the study design, the resources available, the theoretical framework of the research question, and also the biologic plausibility of the exposure to cause a potential health outcome. In exposure assessment, we need to think about 5 things. We need to understand who's the exposed population. We need to gather quantitative information on exposure, if possible, the length, the time, and the duration, and the frequency. And we need to be able to understand how that generates into ultimately a dose and a response. We need to know the medium. Is it air? Is it soil? Is it water? Is it food? And as we saw in the Fukushima, it can be all of them. We need to understand perhaps the microenvironment condition. How much does it vary within a census tract? How much does it vary within a production line in a factory? And we need to use this information and often can use the information collected in one population to assess risk and understand exposure in another. And ultimately, using the concept of biologic plausibility to understand the mechanisms by which this exposure can result in disease. When we think of exposure assessment, we can classify them into direct measures of exposure or indirect measures. Direct measures of exposure consist of personal monitoring, where the individual is wearing a device that enables you to, as closely as possible, approximate their exposure. We can think of biologic monitoring, and we can think of biomarkers. And those are distinct, and I'll talk about them more in a minute. We think of indirect measure of exposure. We can think of sampling the microenvironment to understand concentrations near the individual. We can use mathematical models to estimate the exposure in something like ambient air pollution. We can use questionnaires to ask the person what their source of exposure was. And we can use spatial analysis to estimate exposure. Now, direct measurement may be considered more accurate, but it's generally more resource intensive, and often it's limited in application in environmental and occupational studies. Here is an overview of many of the approaches to exposure analysis in environmental epidemiology. We can see that, as I mentioned, all of this information then gets used to put into exposure models and may ultimately be used in epidemiologic analysis, such as logistic regression or linear regression, depending on the outcome of interest. One important component to understanding what we want to measure, how, and why is to think about the type of dose that we'd like to know. So in exposure assessment, we can attempt to understand the potential dose, which might just be where we measure it near the intake of the person. In a personal monitoring device, let's say we were attempting to measure a chemical in the workplace, we might attach a pump that draws air in, and the person would wear that pump very close to their mouth, as close as possible to where they will be inhaling that chemical. Or if we were thinking about, in this case, oral exposure, we might think about the water at the tap, and that's as close as we're going to get to estimating that. What's the concentration of arsenic at the tap, or what's the concentration of lead at the household faucet in the sink? If we're interested in understanding a more applied or internal dose, or ultimately the biologically effective dose, then we need to take it a step further. And sometimes, depending on the question, that's the most relevant one. We might try and understand the internal dose or the biologically effective dose by taking a measure of blood, urine, hair, fingernails or toenails, and getting at an estimate of what the dose is actually doing in the body. Aside from trying to interpret dose, we also need to think about what kind of exposure scenario we should apply our environmental exposure assessment in. Is it a fixed, a short-term, or a source exposure? What kind of measurements are going to be available? And if we're looking at reconstructed estimates, should we consider biologic samples? There are many issues of concern in exposure assessment, and of course, the biggest one is likely misclassification. Misclassification is probably the largest source of bias for environmental and occupational studies, because we run the risk of classifying an individual as exposed or not if we inappropriately measure their exposure. And this can reduce the internal validity of a study, and it can bias the measures of association. Commonly, we call differential misclassification when, let's say in a case control study, the measurement of exposure is different in the cases than it is in the controls. That we misclassify them more in the cases than in the controls because of some error in how we're actually assessing the exposure statistically or how we're categorizing it. Non-differential misclassification would be that in a case control study, cases and controls are assessed the exposure in the exact same way, and they're often non-differential misclassification has been considered to result in a bias towards the null, whereas differential misclassification can result in either direction. It's a major issue, and it's one of our biggest challenges in environmental and occupational epidemiology. Measurement error, on the other hand, is error associated with different types of problems, and ultimately we would believe that measurement error may actually, if the size of our study was big enough, be reduced to have very little influence. It can be associated with problems with the monitoring instrument. Let's say it has a pretty large error associated with it, but it's crucial to understand the size and scope of it and reduce it as much as possible. Other issues to consider for exposure assessment are the role of past exposures. In past exposures, there may not be readily available information, and we often rely on individuals to respond to a questionnaire. And depending on the study, recall bias and information bias can strongly influence our ability to assess exposures as a result of past conditions. Even more challenging, and oftentimes in past studies, in studies that are trying to assess things in the past, complex mixtures are difficult to assess, to measure, characterize, and understand that the interactive effects are happening. So for the study that we read on Camp Lejeune, one of the major contaminants was trichloroethylene, but perchloroethylene was also in there, as well as vinyl chloride and other chemicals, and it is almost impossible to distinguish which ones would be influencing health outcomes in those settings. And then for biomarkers, where we might be looking to understand, can we use human samples to evaluate the exposure and not rely on environmental data, they have to be well validated to understand how they're related to the exposure, how they get processed within the body, how they might vary from individual to individual. And ultimately, biomarkers can be a very useful tool, but they have to have been well studied and documented to see how they relate to exposures. And the next set of slides will focus on a novel area of work called the exposome.